as I acquired more nursing knowledge and was able to be more efficient in my job as a nursing assistant. It became intimidating for some of the nurses over there, especially my non-Black counterparts, if you understand where I'm coming from. So that's when it really started to hit me that, wow, I can't be Black and be great. These people are just not going to let me be great. And it started affecting my mental health. And because there's this already pressure and to be great and be better and do better and, always stand out as the one doing everything correctly. And so having that pressure along with being the one of few in a room made it even more stressful and challenging for me.
Hello, listeners. Welcome to the You Belong in Here podcast. This is a podcast where we explore the intersection of nursing and racism, racial disparities that African Americans face in healthcare, as well as the inequities that African American nurses, doctors, and nurse practitioners face in the workplace. My name is Dr. Tiffany C. Brown, and I am your host. I am a doctoral level nurse practitioner with more than 23 years of practice in the nursing profession. It is my hope that through hearing the personal stories of triumph and resiliency shared through in-depth interviews from nurses, nurse practitioners, doctors, and DEI experts, you will be empowered in your workplace and know that you belong in here. Now, let's get to our show. Hello, everyone. Welcome to another episode of You Belong in Here. I am Dr. Tiffany Brown, your host. And friends, I am so thrilled to introduce you to my guest for today's very special episode entitled Leaving the House with Your Whole Armor On, the Black Nurse and Mental Health. Yes, sir. Yes, ma'am. We are hitting on the subject of the mental stressors of being a Black nurse. Now, who can relate? Okay. I am speaking today with the one and only Shaquille Tillman. He has been working in the nursing field now for over 6 years, had received his bachelor's degree in nursing and master's degree in nursing informatics. He is a leader in the nursing field, currently working as a patient care manager at Stanford Healthcare, as well as teaching as an adjunct instructor at Samuel Merritt University. He has received numerous awards and accolades in his career of 6 years, including the inaugural Black Employee Advancement and Mentorship through Empowerment Award in 2023, as well as the Patriotic Employer Award from the Office of the Secretary of Defense. He stands tall as a transformational leader in the healthcare field and goes far and beyond the call of diversity, equity, inclusion, and belonging with his leadership. So let's give it up today for my colleague and my friend, Mr. Shaquille Tillman, everyone. Say hi, Shaquille. Hey.
Hello, everyone. Thank you so much for having me here today and for this opportunity. I'm so glad to be here and can't wait to have this conversation with you today.
Oh, absolutely. How are you feeling today? How are you doing?
Feeling good. I can't complain, and even if I wanted to, I don't have any room to, so I'm doing well.
Excellent. Excellent. Well, I am so glad that you are joining me today for this very important conversation. So let's get into it. I would like to first start with an article a couple articles actually, an article I read recently regarding Black nurses and mental health. A health and wellness blog I read from 2022 shared what being a Black nurse means, stating it can mean navigating the weight of being a minority nurse, sometimes the only one on your unit. Now, who can relate to that? Okay. It also means ensuring Black patients receive fair and compassionate treatment, doing your part to promote health equity, dealing with racism from patients, colleagues, and coworkers. And in light of this article suggests being a Black nurse is a stressor itself that can worsen the already complicated occupational stressors that nurses experience. And then another study by Nursing Outlook showed that Black nurses perceive they have a low psychological resilience in stressful situations. They're affected by both lived and vicarious racism, and expect and worry that racism will happen to them or to other Black people. So I want to ask you, in what ways would you say you can relate to these articles?
Wow, probably in every way possible or imaginable. It's the unfortunate truth and reality of being a person of color or Black employee within an organization, especially where you may not be the majority, which is often the case. So those articles definitely resonate in many ways.
Absolutely. I know I can relate to every single one of them. Every single one of them. Mostly all the articles I've read, which I've read many, it speaks directly to me. And I feel like I get that moment where I am one of them and I can 100% relate. So Now, I want to explain a little bit more about what I mean by leaving the whole house with your armor on. It's a metaphor that signifies being spiritually prepared and protected for the challenges that one might face in a daily life. It emphasizes the importance of being spiritually equipped and ready to fight against forces opposite of good. So now, in light of our conversation, what does the statement leaving the house with your whole armor on mean to you?
Wow, I think that statement means a lot of different things, but the most basic understanding for me is just having that, I want to say mental safety or having that emotional safety regulation in place for yourself, knowing that you're walking into that type of environment, right?
Yeah.
Already knowing that this is possibly going to be the day, preparing yourself for that, right? It's unfortunate to say, but for me, making sure that I have my armor on includes making sure that I'm spiritually and emotionally ready. That means that the day has to start with a prayer and a meditation.
Yes.
Before I leave the house, on the way to work, when I get in the garage at work,
Yes.
before I leave the car, stepping onto the elevator, and before I walk into my unit, I have these moments where I'm saying, God, please guide my day, guide my tongue, guide my footsteps. Just be that shield and protection for me, because you don't know what hides behind the corner or what's around the bend coming into that hospital.
Yeah.
So for me, just making sure I have that. I take the Lord with me everywhere I go. I'm more spiritual than I am religious, but I think that in itself is what having my armor on means for me. And once I'm in the environment, having those moments during the day where I have to step away and have that meditation, or step away and say a prayer or have a quick word. That way I'm encouraged to finish the day. So that's what putting on my armor means for me before leaving the house. So I hope that answered your question.
Absolutely. And it's beautiful. I think what a wonderful answer. I know you already, so I know that you're a spiritual person. I know that we both go to work with our armor on every day, and it helps us to get through. I kind of want to segue a little bit. I want to ask you if you can share with our listeners a little bit more about your personal nursing journey and how it affected your perspective on mental health, and particularly within the Black community.
Wow. So I'm from the South. So growing up in the South and being a nurse in the South definitely was an experience for sure. Now being here on the West Coast is an entirely different experience, but I will say my journey into nursing was not an easy one. So when I decided to pursue nursing some years ago, I think this was 2012, 2010, I pursued nursing school. It's been over a decade for sure, but I remember being one of the only ones in my class.
Yeah.
And that was such an intense and rigorous program. And then from being the only one in the class to being one of few on my unit where I worked as a nursing assistant before I became a nurse. And so I'd already had a kind of an insight into what I was looking, forward to as a nurse in the healthcare profession, especially being in the South. And so as I started working towards my nursing degree, and as I acquired more nursing knowledge and was able to be more efficient in my job as a nursing assistant, it became intimidating for some of the nurses on the unit, especially my non-Black counterparts, if you understand where I'm coming from. So that's when it really started to hit me that, wow, I can't be Black and be great. These people are just not going to let me be great. And it started affecting my mental health.
Yeah.
And because there's this already pressure and to be great and be better and do better and, always stand out as the one doing everything correctly. And so having that pressure along with being the one or the one of few in a room made it even more stressful and challenging for me. So I want to say right before I transitioned into becoming a full-time nurse is when I started really recognizing that I need to take better care of my mental health. Because it was affecting my ability to really show up for my patients the way I felt like I should have. It affected my ability to absorb the information I was learning in school. So that's when I started seeking counseling and therapy and things like that. And being a person from the South and a Black person, that's very taboo of a conversation that we have as as a community. Go pray. You ain't depressed, go seek God, read your word. That's okay. And that helps. But sometimes you need a little bit more help. And so right before I became a nurse is when I realized that it's okay that I need therapists or I need counseling and maybe even some antipsychotropics or some antidepressant medications at the time if that's what I needed. But those things helped me to kind of navigate that difficult journey I was having transitioning.
100%, 100%. Thanks for sharing that. I mean, all those things are very poignant topics and points to make regarding taking care of yourself. Like ultimately, you can't be a great provider and a great nurse if you're not taking care of yourself first.
Absolutely.
And it's hard for us as nurses to put, or anyone in the healthcare profession, to put ourselves first. And, like our head, our logic, our brain, our mental health first, so we can actually give better care to our patients. In your opinion, what unique mental challenges do Black nurses face compared to their peers?
Wow. I'm actually glad you asked this question because it's not something that's talked about enough.
Yeah.
I think that whether people want to admit it or not, there's still a heavy racism based energy within the United States, depending on where you are, but it's still very much an issue and it's very apparent. And I think that oftentimes the challenges and struggles of Black people are dismissed based on those stereotypes, based on the history of racism in this country, right? When you talk about healthcare and being a nurse, from the patient advocate standpoint, right, there's so much pressure and stress to make sure that you're advocating 10 times more for patients that are of color than you are for your non-colored, patients because of the racism and the bias in care and all those stigmas and stereotypes. And I think that Black nurses facing these challenges because there's an understanding that we're stronger or we can cope and deal with things differently and handle more, and I think that our symptoms and our issues are overlooked. And so in that sense, I think that when a Black nurse has a concern or a complaint, for example, I think I have within my department maybe a handful of Black employees. And, when they bring their issues forward, I really make sure that I'm checking in and listening because it's very few and infrequent of nature that they actually come forward with concerns.
Yeah.
And when they do, it has to be something that has to really be bothering them. And so I do listen. And then being a person of color myself, talking about having to have that armor on, right, to come to work. Does anybody else that's not Black or identify as Black have to make sure that they're putting on armor to come to work? That's already extra added stress, right? The fear of making a mistake and being frowned upon or talked about or not being taken serious in a room of other leaders when I'm the only one in the room, that adds more stress to my role as a nurse and a nurse leader, right? So when you think about all those factors, the nurses having to deal with racist patients, biased providers, things like that add a lot of psychological stress. And so I think that's where the mental health challenges are more unique for nurses of color because of those extra added layers that they have to deal with during their day-to-day as a nurse.
Thank you for saying that. That's a load, and I hope people are listening and taking notes, and those who are listening and can relate, we really want to share some other things like self-care strategies. So Shaquille, what self-care strategies do you recommend for Black nurses to maintain their mental health and well-being? I know you mentioned therapy, that you found particularly helpful. Are there any other strategies that you can think of or recommend even to some of your employees that you said come to you sometime?
Absolutely. Absolutely. I always direct people to the employee resource groups within your institutional organization, whether you be in a healthcare setting, non-healthcare setting. Most organizations have some type of employee resource group.
Right.
Band together with those that look like you. We have our Black Employee Resource Group called the Beam Team, right? We also have our Black Nurses Association chapter. I found solstice and community in those different, platforms and chapters, for support. That's important. Also having a mentor, getting involved into some type of mentorship program helped me a lot. Oftentimes when we're the only one in the room or maybe the only one of few in the room or whatever setting we're in, we often forget that we're not the first person to be the only one in the room, or we're not the first person to be the one of few in the room. There are others that have gone through those similar situations. And so having that sense of community through those different avenues, like a mentorship program, different organizations, really helped me a lot. One colleague in particular who I consider a great dear friend of mine is an executive leader. And they explain to me all the time, like, these challenges are not going to go away.
Yeah.
Right. Until there's a huge shift, in how this country, operates. These issues that we face are not going to go away no time soon. Maybe not in our, lifetime anyway. And so I really shifted my mindset from thinking of, oh, I'm the only one in the room, I'm the one of few in the room, to how can I leverage this to my advantage?
Yes.
I am the only one in the room because I deserve to be here. How can I make this space more appropriate for others that look like me? How can there be more of me in this room? What can I do to make that happen? And so I had to shift my personality and my mindset to really be able to cope and get through the day dealing with these different situations that we've talked about.
Wonderful. Like you totally touched on several little topics that I was going to inquire about, which is mentorship, which that plays a big part in, being an African American in the healthcare profession. I always said it before that I believe you need mentorship as well as sponsorship.
Absolutely.
Ultimately just someone in your corner, right? You know what I mean? So tell me how it felt for you with your mentor you mentioned, feeling like someone's in your corner, someone to help you. Like, in what ways do you feel like that's even helped you to advance in your career?
It definitely made me feel more empowered. Being a nurse leader was not a career trajectory I had in plan for myself. And again, as a spiritual/religious person, we all know that our plans are not always God's plans, right?
Right.
But I never foresaw a career trajectory in leadership at all. Never. And so when I became a leader, there were so many things I didn't know that I didn't know. So having that mentorship really made me feel like I had a sense of psychological safety. One, I had a safe space. And it made me feel empowered because knowing that I'm not the only one, I'm not the first one going through XYZ, gave me some reassurance that it would be okay. I can get through the situation as many others. And I'm laying and playing the foundation for others to come. So it definitely gave me that confidence, gave me that support that I needed. And it just helped me propel forward in my career.
Excellent. So, Shaquille, I want to ask you a question. What changes or advancements do you hope to see in the future regarding mental health and support for Black nurses and other healthcare professionals as well?
Wow, that's a very loaded question. I think there are a lot of things that I hope to see and things that we can be doing to make the space safer for especially Black employees. I think the one thing that we can do first is just acknowledge that it's an issue. I think that oftentimes we put these different measures in place, we put these different initiatives in place to kind of say we're doing it, but there's no true intention behind the actions. And so, in short, I think you've referenced this before, it's like putting a Band-Aid on the situation, but it doesn't resolve or address the true issues that the employees, especially Black employees, are facing. I think another thing that I hope to see change is actually having clinicians in the space that look like me. It's just a different experience when you have to go share your experience from your perspective to someone that doesn't look like you. They don't understand your challenges. They don't understand your background. And so when they're offering you kind of like advice or guidance and support, it's not really true guidance that you can really put into effect, because if you do something based on, and this happened to me personally, I was provided with some guidance, right, from a non-Black counterpart, and I tried to implement that and it backfired on me. And I had to remember, you are a Black man in a space where you are not the majority. And so you really have to be careful how you navigate situations. So having clinicians in place that look like us, that can help us, with guided support and advice and recommendations on how to move forward with different issues. I think, again, the biggest challenge and barrier I see in the healthcare setting or the clinical space I work in is just not being honest and upfront about what the issues are, right? We want to hear it, we want to address it, but then when we're bringing these issues to the forefront of attention, it's kind of like, oh, well, what you want me to do about it, kind of thing. And so I think those are some of the things that I hope to see change in the future for especially Black employees, but for all clinicians, right? I think it would be beneficial to have someone in a safe space where you can connect with them and feel safe based on, shared experiences, based on background, upbringing, things like that.
Absolutely. I mean, you were pulling on my heartstrings here, specifically regarding not putting Band-Aids on things and, really addressing the issue. Because I'm like, what do we really want to happen? What is the outcome we want? And so that's something good that we should consider. And I hope that other people are considering as well who are leading these organizations. You kind of hit on it a little bit. But I want to ask you, how can we encourage more open dialogue, right? Because we do discuss it, but how can we encourage more open dialogue about mental health struggles in the Black nursing community? And what role can, for instance, this podcast or other media play in the effort?
Well, I don't know if you feel this way, but I feel like anything mental health related is definitely, there's a huge stigma associated with it in the Black community. It's almost taboo of a conversation to have, right? I remember going through nursing school and just feeling so overwhelmed and just feeling at my wit's end, like not feeling like I had a way out and just overwhelmed mentally. And I went to my mom, who's a woman of faith, and she told me to pray. And I said, Mom, I've prayed, I fasted, I've read my word. There has to be something else that can help me because this is not helping me alone. This is not helping me enough. And so I think that one, just knowing that having mental health issues does not make you a weak person.
Right.
Removing those stigmas and those barriers in our community is something that one can address, right? It's still very much taboo of a conversation. And so if we can acknowledge that it's okay to have mental health issues and these are the resources in place to help you, I think we can start moving forward. I think something else that could potentially be a barrier, again, I think I mentioned, was just these organizations that all jumped on this DEI bandwagon, right? When the whole George Floyd situation occurred, very unfortunate event, but I feel like we're not intentional behind our actions. We can't just put measures in place just to say we're doing it to put a check in a box. We have to be more intentional. And how about starting with having those employees that are sharing those experiences be at the table? But in terms of mental health, I think that if we can get to a place where we acknowledge that these are issues and that we want to be intentional about addressing the issues, we can then put measures in place to actually be intentional about addressing it, right? Like I mentioned, having Black mental health clinicians in place for our Black employees.
Exactly.
And that may seem like a big lift, but most organizations probably don't have as many Black employees as non-Black employees, right? So I don't think it's that big of a lift. But yeah, that's just some ideas that I have and some, insight into the question that you asked.
That's a really good answer. And, 100% I agree. And something that I was thinking about, even as you mentioned, like as far as employee EAP.
Mm-hmm.
So a lot of institutions have EAP programs where, nurses or anyone who works at the institution can go ahead and seek, a program or mental health or therapy, I want to try to say, in a EAP. However, personally, I have looked into who is in these EAP groups, and you know what I'm about to say. There are none that I found that look like me. So in the EAP, even when I tried to, seek some help, seek therapy that through my institution's EAP program, I knew there was no one that looked like me. I looked through all the psychiatrists and therapists. And so I found it to be a struggle even when I did go. So, I just want to, stress the importance of, again, having people who look like us, even to give you therapy, because they know your struggle, they know what you've been through. And when you're sharing these things, with some of your aggression, with some of the microaggressions you may be experiencing at work or, racism, et cetera, they can relate to that and actually guide you, I feel like, a little bit better. And you feel more safe to speak on these things.
Exactly right. And I think another point to make is, there's tons of research and data out there that shows that when patients have care from clinicians that look like them, they have better outcomes, right? When patients that are Black have Black providers, they have better outcomes, so on and so forth. So why can't we also do the same in every aspect of care, including mental health? I've been through quite a few therapists, and it was a difficult pursuit trying to get therapy, especially coming from a hyper-religious family where prayer was the answer for everything. And so I'm not saying that I don't pray. I'm not saying that I'm not a man of faith. But what I'm saying is there have been more times than not where I've had to be like, you know what, this ain't working. It's, it's like a relationship and this ain't working well. We're not matching well because I don't feel like they're hearing me. They're not understanding where I'm coming from. I don't want to have to go around the bend and tell you about how I was raised and what this means as a Black person when someone does X, Y, Z. It's so much easier when I had a Black therapist that understood that these are our challenges and barriers as a people. So when I went with my issues, they were able to, like you said, better guide me and give me that advice and that support that I needed. And it was more effective. And here I am today, in a better mental space, thanks to my therapist and all the other things that are available to us. Unfortunately, not as much as it should be, to help me, get in a better headspace.
Absolutely. Thanks again for sharing some of your struggles with our audience too. I want to ask you, like, as an educator, because I know you're an adjunct instructor, right? And also as a leader, in your opinion, how can nursing education programs better prepare future nurses to address mental health concerns early on, right? Especially, in diverse populations or areas where they likely won't be in diverse populations?
I think one thing that we could do in the nursing curriculum or the nursing education world is really put more simulation-based education that's centered around DEI, the lived experience of Black employees. Because if you can understand the perspective and lived experience of a Black person, you can better address them. You can better provide care. You can better meet them where they are. And I think oftentimes the text is not always as valid as it appears, right? I think there was a study that I read that said that Black people have thicker skin, or we have a higher pain tolerance, right? So if you're teaching this in nursing schools, right, they're going to already have a misperceived perception of Black people and how they address care of Black people. And that can be true and also the same when it comes to mental health. They probably think we're stronger, we're more resilient, we can tolerate more. And so when they're interacting with us or dealing with us, they're not understanding that, hey, I'm a person just like you beyond me being a Black person. And based on what you were taught, that's not always accurate and true. So I think really addressing the curriculum and really looking at what is in the text, what are we teaching these nursing students, and then implementing these simulations that better equip them with the tools they need to address patients that are Black when they're caring for them. I think that would help with the mental health issue in Black patients as well, because people don't understand our struggles and they don't try to understand. We're very diminished people, right? They diminished our issues, they diminished our complaints and our frustrations because for whatever reason, they don't think it's important. And so I think that's one area we can address, right? DEI simulations, mental health simulations regarding Black employees, Black patients, and that way we can address the mental health issue. I think that's one of the many ways. And so what I'm doing now currently is when I'm teaching my students, I'm sharing my lived experiences with them in relation to whatever the topic is, right? For example, I think there was a recent cardiac seminar that I presented, and I talked about my lived experience with a relative of mine who was not treated properly because of their skin color, right? And so sharing that experience with them, I hope will resonate with them when they have that issue come up in the future. Hopefully it doesn't. But when they're caring for someone that's Black or a patient that identifies as Black, they will remember me talking about my own personal experience, and hopefully that will change how they interact and approach the care of the patient. So definitely more simulation-based education, really looking at the text and seeing what's in this text. What are we teaching these students? Is it really accurate and true today? And that way we can start addressing the issue.
I love the idea of bias simulations. I did not get that through any of my schooling.
Neither did I.
And it's not just to say that we as African-American people, as Black people, cannot have biases as nurses with other cultures. And so I think it'll be beneficial for all cultures to have like a bias simulation put into the nursing program. And I think we should talk about it offline.
We definitely should, because I think what's alarming to me is to know that we as Black people represent such a small majority or a small percentage of the population here in this country, but we have some of the worst outcomes in terms of health and our healthcare, and you can't help but wonder why, right? And so when you really start peeling back the layers, you see we're not treated properly when we receive care. They don't take our mental health issues seriously, right? They diminish our concerns. We have the highest maternal health mortality rate in the country, right? And even though suicide rates are high and we are one of the smallest populations in this country, we represent one of the biggest, percentages of the suicide rate in this country as well. So clearly there's an issue, and I don't think we're really being intentional about addressing them. And so I'm glad you're having this podcast and creating this space, and I hope that this will stimulate more conversations with people about this topic, because it's super important and it needs to be had.
I 100% agree. And I hope to talk about this more. And even hopefully in the future, I'll have a African-American or Black psychiatrist join the show as well. We continue the discussion about mental health, period. Not just in the nursing field, but in the overall African-American community. Because like you said, there's a disparity there with us as well. And suicide rates are high, and depression, people do not go to therapy. So we need to talk about it. So we're going to continue this conversation in the future, everyone. For right now, I do want to ask you what resources, you're very resourceful. So what resources such as books, websites, organizations do you recommend for Black nurses seeking support for their mental health?
All right. So for mental health, because I've been all over the place, right? And I've just found so many different things that work for me, and I picked and pulled from different places. I read a lot of books. One book that always sticks out to me is The Subtle Art of Not Giving a I don't know if you read that book. It really changes your perspective on how you approach life. And so I think just one, having, a support system in place, right? Your friends, your colleagues, or people that you can trust and confide in is super important. We all need that safe space with someone. I am a member of the National Black Nurse Association. I found a sense of community in my local chapter and in my wonderful and amazing colleagues that I interact with almost daily. That's something that's been super helpful and a blessing to me. Also, just knowing that, you're not alone and you're not the first person to navigate whatever it is that you're navigating. So finding those support systems, for example, there's a support group online that I'm a part of for Black males that have, had issues in the past in terms of like childhood trauma and things like that. I'm a part of that group. It's super anonymous. You don't have to show your face on camera. It's a safe space where you can come off mute, share your concerns, share your frustrations, share some of your struggles and challenges you've been facing, and get support from that community. So those are some other resources that I've tapped into. Of course, there are the employee resources, but again, I haven't found them super helpful, so I don't even use them, honestly. I wish that money can be directed elsewhere where it can be more beneficial, but those are just some of the few resources that I use daily. I also read my Bible. I do fast and meditate. And there are some other books that I'll happily share with you. I don't remember all the titles right now that I think will be helpful in kind of addressing some of the mental health issues or helping you feel that you have a way out of the situation that you may be in.
Thank you so much for sharing all those resources. Now, kind of like go into the Pearls of Wisdom segment as we get ready to close the show. So as we all know, pearls symbolize inner wisdom. So this will probably be the last thing that you share with our listeners today. So what piece of advice would you give to the other African-American nurses or nurse leaders that may be experiencing some challenges that you have faced in your career or as you were entering into the nursing field, period?
Wow, that's definitely a good question. I have a few pearls of wisdom that I'd like to impart and leave with the audience. Number one is a quote that I kept in the back of my mind and in my front and back pockets since navigating nursing school and being a nurse, being a nurse leader, being an educator, is no one said it would be easy, but it is doable. And that came from one of my deans of nursing, the first ever Black dean of nursing that I ever interacted with and met when I was pursuing nursing school. And that's so applicable to many different situations. It was applicable to nursing school. It was applicable to navigating my new role as a manager. It's applicable to me being a new educator. It's not going to be easy. No one said it was, but it's doable. You can do it, right? And then another pearl of wisdom that I will offer is just knowing that it's okay that you may be the only one in the room. Use that to your advantage, right? You're there for a reason. You're there for a purpose. And I know oftentimes we don't understand the purpose. We don't understand the reason in that moment, but know that you are there for a purpose. You are there for a reason, for a season, and we don't understand it now, but we will understand it. And you could be that person that could be that pioneer paving the way and shaping the future for the next generation of workforce of nurses. So hang in there. Know that you got support. There are different ways to get support and navigate these resources so that you can feel empowered to keep going and pushing forward. So we got you. And it's going to be fine. We're going to get through it.
Yeah. Well, everyone, thank you so much for listening. This concludes the episode of You Belong in Here. Thank you, Mr. Tillman, for being such an amazing guest, sharing your nursing journey and these wonderful pearls of wisdom, just all the resources that you gave. They're diamonds, okay? Thank you all for tuning in. As usual, we hope this episode reminds you that your presence is necessary and that you truly belong, not only in your workspace, but you belong whatever space that you're in. It could be school, anywhere you belong there as African-American and Black person, or just anyone else who may be of a diverse race as well. So if you found this episode encouraging, motivating, inspiring, or and or empowering in any way, please like it, share with others. You can find my podcast on YouTube, Spotify, Apple Podcast. You may also go to my website, belonginherepod.com, to find guest information and podcast episodes as well. Tune in to the next episode in 2 weeks, where we will continue to explore topics in health equity as well as equity in the workplace. All right. Till then, take care and keep moving forward.